Senator Pavley.
Thank you very much. Members, most of you know that 2.5 million previously uninsured Californians are receiving health care under the Affordable Care Act, and we're all faced with a shortage of physicians in our state for a variety of reasons. And we have an even greater need for high-quality, efficient, team-based care across all medical settings. And we've had bills recently on the floor that are trying to accomplish just that. But this is especially true for the practice of physician's assistants, who are authorized to provide physical exams, to diagnose and treat illnesses. They're authorized to prescribe medication, all under the supervision of a physician. What you may not know is most PAs have graduated from a four-year college and have the requisite science classes, and then they go on and, in many cases, get a master's degree, a 2- to 3-year program on top of that. SB 337 recognizes the growing changes in medical practice settings and the use of electronic medical records to update methods for documentation and the supervision of PAs. Specifically, SB 337 increases options for the physician and PA team to document supervision. The options included in this bill will strengthen the team-based approach. Under this bill, physicians are still allowed to co-sign all, that's 100% of prescriptions within 7 days, but are also allowed the option to reduce the number of co-signatures to about 1 in 5, only if alternative forms of monitoring are used and a physician's assistant meets additional requirements, such as special coursework. Senate Bill 337 maintains an active supervision relationship and focuses resources on patient care and improving efficiencies in practice. This bill passed out of Senate B&P on a 9-0 vote. It is sponsored by the California Academy of Physicians Assistants. Ask for your aye vote.
Thank you. Any debate or discussion? Senator Stone.
Thank you, Mr. President. I stand in support of SB 337. There are many wonderful attributes of a physician assistant. One of them is they even write for narcotic utilization within clinics, and sometimes they use pharmacies, such as my compounding pharmacy, to prepare medications that go back to the doctor's office to be administered by the doctor's offices. They are also given DEA numbers. So their DEA numbers, along with the physician's DEA numbers, are all monitored by Cures. So if you see any aberrant data, certainly they can be prosecuted, and of course, they'll lose their licenses to practice. So this streamlines the medical processes at a time when we have a shortage of primary care physicians. They are educated, they are well-versed in the law, and are a very important member of the healthcare team. I urge your aye vote.
Thank you, Senator Stone. Any other debate or discussion? Seeing none, Senator Pavley, would you like to close?
Yes, thank you very much, and thank you to my colleague, Senator Stone. This bill does not change or dilute the supervision of the PA by the physician. PAs have growing importance and responsibilities in extending access to care. Ask for your aye vote for this measure.
Great. Thank you, Senator Pavley. Members, any objection to a unanimous roll call? Seeing and hearing none, ayes 38, noes 0. Measure passes. Moving on to file item 17, Senator De Leon. Secretary, please read.
Senate Bill 556 by Senator De Leon, an act relating to victims of crime.
Senator De Leon.
Thank you, Mr. President. Thank you, colleagues, for the ability to rise and present SB 556. This is a bill that will ensure that crime victims receive the financial assistance that they are owed in a timely manner by clarifying the start as well as end time for the California Victims Compensation Program. The VCP, which is used in processing the applications to determine eligibility. This is a measure that passed out of public safety on a bipartisan vote, a unanimous vote. With that, Mr. President, I respectfully ask for an aye vote.
Great. Thank you, Senator De Leon. Any debate or discussion? Seeing and hearing none. Any objection to unanimous roll call? Seeing and hearing none, 38-0. Measure passes. Let's move to file item 18. Senator Stone, pass on file. File item 19, Senator Galgiani, pass on file. File item 20, Senator Pan. Secretary, please read.
Senate Concurrent Resolution 58 by Senator Pan relative.
Oh, excuse me, I'm sorry. Pass on file. All right, file item 21, Senator Hueso. Secretary, please read.
Senate Bill 287 by Senator Hueso, an act relating to automated external defibrillators.
Thank you, Mr.
Senator
President. Senators, I'm proud to present SB 287. This bill is modeled after an ordinance that was passed when I was a member of the San Diego City Council. It would require most newly constructed buildings after January of 2016 to have an automated external defibrillator, or also known as an AED device. It's a life-saving device used in the instance where people are experiencing a heart attack. This year, over 350,000 Americans are expected to suffer from sudden cardiac arrest. 9 out of 10 will not survive. Timing matters, and it's very important to receive some level of assistance in the first few minutes or the first precious seconds. Receiving a shock from an AED device within the first 4 to 6 minutes can increase the likelihood of survival by as much as 70%. I would like to thank Senator Hill also for his work on SB 685, which has addressed the major concerns of opposition and of which this body passed unanimously this week. I will continue to work with the opposition as this bill moves through the process. This bill has received bipartisan support in committee, and I ask for your support today on this important life-saving measure. Thank you.
Thank you, Senator Hueso. Any debate or discussion? Yes, Senator Berryhill.
Yeah, question of the author.
Yes, Senator Hueso, will you accept the question? Yeah, please proceed.
Yeah, as I look at this bill, and believe me, I can tell you a lot about defibrillators. I had one before my heart transplant. I got up close and personal to that thing many, many times. But it's interesting where we mandate the private sector that they've got to have these things, and yet we exempt public buildings. Can you give me a good reason why why?
Yes, Mr. Berryhill, this question has been asked very much, and there was a memorandum issued by the Director of General Services, which is much like a law within the administrative level, that not only will mandate them for all brand new buildings, but goes a step further. It goes a step further than this law, and it also requires that AEDs be put in all existing buildings that fit this requirement. So we don't feel this bill only covers all new construction. I wish we could go further than that, because anywhere where you have a large congregation of people, it would just be wise of our public policy to do that. But at the state level, it's currently unnecessary.
So what this bill is saying, that if we build additional government buildings, that they would be required also to have these devices?
Under the memorandum, yes. Under the administrative policy, all state buildings that meet this requirement will have AEDs, yes.
Great, thank you.
Thank you, Senator Berryhill. Members, any other questions? Senator Nguyen.
Thank you, Mr. President. I just want to thank our senator for putting this bill forward. One of the comments that I made during the committee hearing is that I do hope that even though this is going forward for new buildings, we should look at school districts, because a lot of children, especially those who play sports, are the one who are prone to have the potential attack that why they're on the field. And so for years now, I've actually been helping and working with nonprofits and et cetera to take some of these old defibrillators and to make it, recycling it back and giving to the school districts and the schools so that they have it available for these children. And so as we move forward, this is an important tool, not only just for areas that has a lot of adults and families, but going backwards, though, we do have schools and children who are very, I mean, when they're out there playing football, running the hard sports games, that, this is something we should look at, and it's worth the investment because every child, just that one time, if it's your child, you would regret it for the rest of your life. And so I do hope that, our senator and anybody on this floor would, in the future, look at the school districts and anywhere that has a lot of children, especially when it comes to combat sports or aggressive sports. Thank you.
Thank you, Senator Nguyen. Any further debate or discussion? Seeing none, Senator Hueso, would you like to close?
Thank you, Mr. President. I appreciate those comments, and I appreciate everybody's support. This is, again, intended to save lives, and I think with this vote today, we will save many Californians' lives with this effort. So I encourage an aye vote today. Thank you.
Thank you, Senator Hueso. Secretary, please call the roll.
Allen. Aye. Anderson. No. Bates. Bell. Aye. Berryhill. Block. Aye. Canella. Aye. De Leon. Aye. Fuller. Gaines. Galgiani. Aye. Hall. Hancock. Aye. Hernandez. Aye. Hertzberg. Aye. Hill. Aye. Hueso. Aye. Huff. Aye. Jackson. Aye. Lara. Aye. Leno. Aye. Leyva. Aye. Liu. Aye. McGuire. Aye. Mendoza. Aye. Mitchell. Aye. Monning. Aye. Morlock. No. Morrell. No. Wynn. Aye. Nielsen. Pan. Aye. Pavley. Aye. Roth. Aye. Runner. Aye. Stone. Aye. Vidak. Wachowski. Wolk. Wolk, aye.
Secretary, please call the absent members.
Bates. Berryhill. Fuller. Gaines. Hall. Nielsen. Vidak. Wachowski.
Ayes 28, noes 3. Measure passes. Members, file item 22. Senator Hueso. Pass on file. File item 24. Senator Hancock. Secretary, please read.
Senate Bill 196 by Senator Hancock, an act relating to elder abuse.
Thank you, Mr. President. AB 196, SB 196, provides a narrow ability for adult protective service agencies to file a petition for a protective order while a conservator is being sought, but there is a need to step in and stop abuse while the fairly lengthy conservatorship process is going on. This bill authorizes a county adult protective service agency to file a protective order on behalf of an elder or dependent adult when there is reasonable cause to believe that an elder or dependent adult is in imminent danger of becoming or has become a victim of crime and has an impaired ability to understand the circumstances or risk, or if they have suffered abuse and have the same impaired ability. Also, if the elder or dependent adult has provided written authorization to an adult protective service agency to act on their behalf. As with any protective order request, a court would review and approve or deny the request in order to provide the necessary checks and balances. This bill has received bipartisan support, and I would ask for your aye vote.
Thank you, Senator Hancock. Members, any debate or discussion? Seeing or hearing none. Members, any objection to unanimous roll call? Hearing and seeing none, ayes 38, noes 0, measure passes. File item 26, Senator Pan. Secretary, please read.
Senate Bill 145 by Senator Pan, an act relating to health facilities.
Secretary Pan.
Thank you, Mr. President.
Excuse me,
Members.
Senator Pan.
Thank you. Thank you, Mr. President. Members. I present to you SB 145, which prohibits a hospital from transporting a patient who's deemed medically unstable due to severe intoxication to another location, except when the patient is stabilized or appropriately transferred to another licensed health facility. Substantial evidence reveals that Prime Healthcare Services are transferring patients who are admitted to the emergency room for acute alcohol poisoning to police departments, correction facilities, and county jails by calling 911. Despite being one of the largest hospital chains in the state, Prime has an unusually high number of cases where the police are called on patients in the emergency room. For example, in the first 3 months of 2014, 124 emergency calls came from Shasta Regional Medical Center, which is a Prime hospital. This averages to about 41 calls a month. In comparison, Dignity Health's hospital, Mercy Medical Center, which is located only 2 miles from Shasta Medical Center, had only 53 emergency calls in the first 9 months of 2014. What has been documented at Prime hospitals highlights a hole in the current law when it comes to preventing hospitals from dangerously transferring patients. SB 145 is intended to stop and prevent this practice that poses a risk to patient safety. I respectfully ask for an aye vote. Thank you.
Thank you, Senator Pan. Members, any debate or discussion? Seeing none? Oh, Senator Morlock, please proceed.
Mr. President, I just have a question for the author.
Senator Pan, would you accept a question? Yes,
Senator,
proceed.
So we're focused on one healthcare provider, and we're asking them not to transfer patients. So you want to keep them at that hospital?
No, what we want to be sure is that people are not, hospitals are not calling 911 to have patients that are intoxicated transported unsafely out of their emergency room into to other facilities. And we've heard cases where basically patients have then reappeared in other hospitals medically unstable, and we believe this, certainly believe this is a dangerous practice.
So if I follow through, just again ask the question, if someone is at Prime Healthcare and they call 911 and ask them to be transferred to another hospital, you're saying that should be disallowed, therefore the patient stays at Prime Healthcare?
No, we're not saying it's being disallowed. We are concerned, though, that they are utilizing this in an excessive manner, and that we want to be sure there's actually due consideration given before calling 911 and having the patients transported out of the facility.
Great. Thank you, Senator Morlock. Members, any further discussion or debate? Seeing or hearing none, Senator Pan, would you like to close?
I respectfully ask for an aye vote. Thank you.
Great. Thank you. Secretary, please take the roll.
Allen. Aye. Anderson. No. Bates. No. Bell. Aye. Berryhill. No. Block. Aye. Cannella. De Leon. Aye. Fuller. No. Gaines. No. Galgiani. Hall. Hancock. Aye. Hernandez. Aye. Hertzberg. Aye. Hill. Hueso. Aye. Huff. No. Jackson. Aye. Lara. Aye. Leno. Aye. Leva. Aye. Liu. Aye. McGuire. Aye. Mendoza. Aye. Mitchell. Monning. Morlock. Morrell. No. Wynn. No. Nielsen. Pan. Aye. Pavley. Aye. Roth. Aye. Runner. No. Stone. No. Vidak. No. Wykowski. Wolk.
Secretary, please
Nielsen,
call the
no.
absent members.
Cannella. No. Galgiani. No. Hall. Hill. Mitchell. Aye. Monning. Aye. Morlock. No. Wykowski. Wolk.
Secretary, call the absent members.
Hall. Hill. Wykowski. Wolk.
Senator Pan moves the call. Members, moving to file item 27. Senator Wykowski, are you ready to bring this measure forward? Great. Secretary, please read.
Senate Bill 177 by Senator Wachowski, an act relating to alarm companies.
You may proceed.
Mr. President, this bill simply extends for 3 years the sunset provision, which allows alarm companies to form as a limited liability company. I would urge an aye vote.
Great. Thank you, Senator Wachowski. Members, any discussion or debate? Seeing and hearing none. Members, any objection to unanimous roll call? So there is an objection. We'll take a roll call vote. Secretary, please call the roll.
Allen. Anderson. Aye. Bates. Aye. Bell. Aye. Berryhill. Aye. Block. Aye. Canella. Aye. De Leon. Aye. Fuller. Aye. Gaines. Aye. Galgiani. Aye. Hall. Hancock. Aye. Hernandez. Aye. Hertzberg. Aye. Hill. Aye. Hueso. Aye. Huff. Aye. Jackson. Aye. Lara. Aye. Leno. Aye. Leyva. Aye. Liu. Aye. McGuire. Aye. Mendoza. Aye. Mitchell. Aye. Monning. Aye. Morlock. Morrell. Aye. Wynn. Aye. Nielsen. Aye. Pan. Aye. Pavley. Aye. Roth. Aye. Runner. Aye. Stone. Aye. Vidak. Aye. Wachowski. Aye. Wolk. Wolk, aye.
Secretary, call the absent members, please.
Allen. Aye. Hall. Morlock. Morlock, aye.
Ayes 38, no 0. Measure passes. Members, moving to file item 28. Senator Pavley. Secretary, please read.
Senate Bill 226 by Senator Pavley, an act relating to groundwater.
Yes, thank you very much. This bill's about groundwater adjudication. For those of you who don't have the pleasure of being on the Water Committee, adjudication is a legal process to determine how much groundwater does an overlying property owner have the right to. And adjudications are a legal proceeding usually initiated by a lawsuit alleging that a property owner has been harmed, perhaps by too much groundwater being taken out of a basin from a neighboring property owner. Everyone agrees that the process to determine groundwater rights needs to be streamlined. Many people testified last year at all those hearings relating to the Sustainable Groundwater Management Act that was signed into law last year. The Senate Natural Resources and Water Committee had a hearing last fall titled Resolving Disputes Regarding Groundwater Rights, try to figure out where all the time sinks were in the adjudication process. I had promised all the stakeholders that we would spend some time looking at how to streamline adjudication, and I made good on my promise. We had the hearing. This bill takes 4 or 5 of the concepts from that hearing, and that's what's before you today. There is a problem. In fact, right now in the Antelope Valley, the adjudication process has been going on for at least 15 years, and it's not over yet. I think the only beneficiaries of that have been lawyers, but we love lawyers. The goal of Senate Bill 226 is to reduce needless delays while still protecting due process rights. This bill addresses the following issues. Number 1, it addresses basin boundaries, sometimes confusing. So the boundaries shall be identified in Department of Water Resources Bulletin 118 unless modified as provided in the Sustainable Groundwater Management Act. Number 2, regarding notice and service, notice to known parties is provided in the Code of Civil Procedures. Unknown parties, if you can't find them, would be served by publication. Number 3, regarding discovery, will follow the federal procedures, which require disclosure of specific items without awaiting a discovery request. And number 4 in this bill is in regards to expert witnesses. This too will follow the federal procedures, which require an expert witness to provide a written report on opinions the witness will express and the basis and reasons for them. With these changes, Senate Bill 226 will reduce needless delays while still protecting due process rights. I ask for your aye vote.
Thank you, Senator Pavley. Any debate or discussion? Senator Huff.
Thank you, Mr. Chair and members. I rise to oppose this bill in its current form, and I understand there's some effort to perhaps amend it as it moves along, but I'm not voting on that right now. It does add a chapter to the Sustainable Groundwater Management Act, approved in 2014, that purports to provide a streamlined adjudication process for the establishment of groundwater rights. It's unclear, though, how this bill would save any time over the current process and could actually extend adjudications. Currently, when multiple parties withdraw water from the same aquifer, groundwater pumpers can ask the court to adjudicate or hear arguments for and against to better define the rights that various entities have to use groundwater resources. This is known as groundwater adjudication. Unfortunately, it can take years to navigate procedural obstacles to bring all relevant parties into adjudication action. Often this is because while the action may start with only a few parties, it can evolve into an adjudication of all groundwater rights in the basin, affecting thousands of groundwater extractors. Example, the Antelope Valley Groundwater Basin adjudication. An adjudication of the Antelope Valley Groundwater Basin has been sitting in a trial court for 15 years. Parties include cities, farmers, the federal government, and a class of 85,000 property owners who hold groundwater rights but who've never pumped water. This bill gives special standing to intervene at seemingly any time during the adjudication to the Department of Water Resources and the Department of Fish and Wildlife. The interest of two state agencies is essentially elevated above the interest of the human claimants who are party to the lawsuit to determine groundwater rights. Local agencies are already in the process of forming groundwater sustainability agencies that were required by the Act. The Act should be given time to be implemented before significant changes such as this are implemented. The SGMA planning process should not be interrupted by the changes proposed by this bill, so I would ask for your no vote.
Thank you, Senator Huff. Members, any more debate or discussion? Seeing none, Senator Pavley, you may close.
Yes, thank you very much. Appreciate the comments, and Senator Huff noticed that this bill will be continued to be worked on. I also look forward to working with Assemblymember Aleo, who has a similar bill, not that they disagree with each other. His goes a different direction in addition to mine. This bill, especially if you supported the Sustainable Groundwater Management Act, is promises kept to the people that had concerns about how long it takes to adjudicate a basin. I'm hoping, frankly, under the new Groundwater Management Act, that once they have an agency and then they come up with their plan, that before the 20 years to have a sustainable basin arrives, they have not had to adjudicate through legal proceedings, but are able to determine a fair way and to distribute a very limited water supply. Ask for your aye vote in the streamlined process.
Thank you, Senator Pavley. Secretary, please call the roll.
Allen. Aye. Anderson. No. Bates. No. Bell. Aye. Berryhill. No. Block. Aye. Cannella. No. De Leon. Aye. Fuller. No. Gaines.
No.
No. Galgiani. Hall. Hancock. Aye. Hernandez. Aye. Hertzberg. Aye. Hill. Hueso. Aye. Huff. No. Jackson. Aye. Lara. Aye. Leno. Aye. Leyva. Aye. Liu. Aye. McGuire. Aye. Mendoza. Aye. Mitchell. Aye. Monning. Aye. Morlock. No. Morrell. No. Wynn. No. Nilsson. No. Pan. Aye. Pavley. Aye. Roth. Aye. Runner. No. Stone. No. Vidak. No. Wachowski. Aye. Wolk. Wolk aye. Hill aye.
Call the absent members.
Galgiani. Hall.
Ayes 23, noes 14. Measure passes. Members, without objection, I'd like to bring up file items 31 and 36 so that we can adjourn by 3:30.